Hi, guys. Greetings from Better Man Clinics, and welcome to Ask the Expert, the segment of the program in which actual questions from our viewers and listeners are answered by the foremost experts in the field. Today's question comes from Jim in Charleston, South Carolina. Jim asks, how do you know if you're cured after prostate cancer surgery? In order to answer Jim's question, we turn to urologic oncologist Dr. Alexander Kutikov. Here is his response.
That's one of the advantages of surgery is that you really know where you stand as far as your disease progression or disease recurrence, because your PSA should be either incredibly low or undetectable. There's sometimes just a touch of a detectable PSA. We think maybe the urethra makes that PSA. So having a slightly detectable PSA is certainly not the end of the world. But as long as it stays in the same level or stays undetectable, that's how you really know that you don't have any prostate cancer recurrences. Now, the recurrences come in all different varieties, and how fast that PSA rises afterwards also matters and also determines how things are addressed and how things are treated. And there's a whole spectrum of PSA rising very, very slowly, where over really years and decades, where it doesn't really need to be addressed, versus PSA rising at a good clip where radiation makes a lot of sense as a second hammer to still offer a cure, versus PSA doubling time of less than 10 months, of doubling so quickly that it is likely a sign that the prostate cancer cells are no longer in the pelvis, are somewhere else in the body, like the bones or lymph nodes.